Greetings, everyone. It is our pleasure to come together to talk about the Inflation Reduction Act and the new Medicaid renewal process. Something important in the United States and its territories as we move forward. Let me first also remind you all that October 15th is an important start date. That is the start date for Medicare sign up. And so we want to make sure that we were doing this early enough so that you can have some more information and be informed as you move forward, as you help others move forward. Remember, you may not be eligible for Medicaid or Medicare at this point, but I know you know somebody, your next door neighbor, someone in your household, someone in your congregation, someone that you meet on the street. Please pass on the information as we always do. It is my privilege now to be able to introduce Veronica Moore, who is a health insurance specialist at the Centers for Medicare and Medicaid Services. She's in the Office of Program Operations and Local Engagement. She is been in the federal career with Medicare and Medicaid Services since 2010 in the Division of Health Plan Operations in Region 6. She leads regional outreach and local engagement work in the Inflation Reduction Act. Her work is also around raising awareness of issues impacting maternal health, healthcare access, and equity in underserved and underrepresented communities. It is a pleasure. She resides in Texas. You know what? She resides in Texas, but as I read her bio, I'm going to presume that she is a member of that other sorority, uh, Delta Sigma Theta Sorority Incorporated. I am one of your D9 sisters, a member of the Alpha Kappa Alpha sorority. We work well together as we try to impact health and healthcare across the world. She's a champion of maternal health, as well as ensuring that even the Boys and Girls Clubs of Greater Dallas strive and to greatness as she sits on their advisory board. She's worked in public health systems as well as in the nonprofit and private sector of the healthcare industry. It is my privilege to introduce Veronica Moore, who will introduce her colleagues. She will be talking about the Inflation Reduction Act, and her colleague Angela Kane will be talking about the Medicaid renewal process. Veronica, we are in your hands. Thank you.
Thank you. Thank you so much, Dr. Burnett, for having us today. We certainly appreciate the opportunity to come on and share with you these very important updates as it relates to Medicare and Medicaid. I want to start out by introducing my colleagues that have joined me this evening, and I want to thank them for their time and also for being a part of this. I will start with the gentleman in the room, Mr. Dennis Del Pizzo. Dennis, would you like to introduce yourself and let the folks know what areas you cover?
Veronica, thank you very much. Yes, Dennis Del Pizzo. I am in the CMS Denver regional office. And CMS Denver, we consider ourselves Region 8. And so we cover the states of Colorado, Montana, the Dakotas, so North and South Dakota, Utah, and Wyoming. So we have a 6-state region. We're the smallest region by demographic as far as the number of individuals enrolled in our programs, but we are the largest by territory, geographic territory. So we cover a large amount of space in our region. And I am here in our region, I serve as a marketplace open enrollment lead. So the marketplace is the option for people that don't have access to other forms of insurance, such as through government sponsored or employer group. And so if they're in between or don't have access, maybe they've lost Medicaid, so the marketplace would be an option for people that we always like to make people aware of. And most everyone qualifies for financial assistance. As we mentioned too, and kind of the thrust of our conversation tonight is talking about the Inflation Reduction Act. And so I'm working as a lead in our office to get the word out to our beneficiaries and constituents regarding the key provisions and how they will be implemented over the course of the next several years, and the savings associated with that and the benefits associated, and how people can take advantage of that. And then we're talking about Medicaid unwinding or Medicaid renewals and Medicaid redeterminations. And so as of March 31st, all states are in some form or fashion renewing everybody enrolled in Medicare or Medicaid. Everybody enrolled in Medicaid and CHIP, the Children's Health Insurance Program, and to make sure that they are still eligible. And for most in this situation, or for many, I should say, they may have not been through an eligibility determination before, so they are kind of mystified as far as what is happening. Why am I getting this piece of paper? Why is my state requesting this information? Or they might ignore it. And so we want to avoid that as much as possible. We have other campaigns that we talked about: Medicare open enrollment period, October 15th or December 7th, which is the time each and every Medicare beneficiaries, we actively reach out and try to reach all beneficiaries and encourage them to look at how their plan is changing for the upcoming plan year, and if there is a better option and choice that might be available with the 2024 plan offerings that will become available at the end of this month, the first part of October. So just in brief, Veronica, that's kind of where I stand. I've been with the Medicare program for 35 years, and we have a 4-person team here in the Denver office, but you can reach any one of us about anything related to CMS programs, and we will certainly take it and assist you and help you navigate our programs however we can. Thanks, Veronica.
Thank you. Thank you so much, Dennis, and we appreciate your service. 35 years, that's a long time. Thank you. Next, I will go to my colleague, Christina Collazo. Christina?
Hi, thanks, Veronica. And very nice to meet you, Dr. Burnett, and all my colleagues. My name is Christina Collazo, and I am an outreach specialist here in San Francisco, Region 9. And our region covers the states of California, Nevada, Hawaii, Arizona, and the Pacific Territories as well. So that's Guam, the Northern Mariana Islands, and American Samoa. And I serve as the lead in our region for the Inflation Reduction Act, and work closely with Veronica on that and outreach strategies. And then I also serve as the lead for the No Surprises Act. So that's the fairly recent consumer protection law against surprise medical bills. So it's basically for people who are uninsured. There's certain protections in place where medical providers have to give them a good faith estimate of services in advance of them receiving those items or services, and then other requirements as far as prohibitions on surprise medical bills for like emergency services or out-of-network services at an in-network provider or facility, and air ambulance services as well. So there are consumer protections against surprise medical bills for those 3 right now, and then there's an independent dispute resolution process between the patient and the provider for surprise medical bills. That's kind of that in a nutshell. And I also serve as the lead for outreach to the Spanish-speaking community as well in our region. So yes, very nice to meet you and glad to be here today.
Thank you. Thank you so much, Christina. I'll go ahead and give it to, I'm going to go ahead and go with Angela. Angela, would you like to introduce yourself and share a little bit about just, the areas that you cover here in Region 6?
Yes, thank you, Veronica. Hi, my name is Angela Kane. I'm an outreach specialist at the Dallas Regional Office of the Centers for Medicare and Medicaid Services, where we provide outreach and engagement to our partners who serve beneficiaries that are on Medicare, Medicaid, or the health insurance marketplace. And Medicaid also includes the Children's Health Insurance Program, or CHIP, that Dennis mentioned earlier. And I am the lead for Medicaid Unwinding, and looking forward to speaking with you, giving you some high-level points about it later. Thank you. Thank you, Veronica.
Thank you. Thank you, Angela. And then I will go to my colleagues that we are tasked with. Pretty much all of our work, just about almost, is all about the Inflation Reduction Act. So I will start with Lisa.
Hello, and good evening, Dr. Burnett. It's wonderful to meet you. And also all my colleagues, it's good to meet you as well and see you all tonight. I'm happy to be here, Veronica, and thank you so much for this opportunity. Dr. Burnett, I am the IRA specialist for Region 4, and that's basically all the Southeast regions. So that includes Kentucky, Tennessee, North Carolina, South Carolina, Georgia, Alabama, Mississippi, and Florida. So we have 8 states that I cover, and provide outreach on the IRA, as well as I'm working on outreach for open enrollment this season as well. So I'm glad to be here tonight. I'm fairly new with the Centers for Medicare and Medicaid Services. My office is out of Atlanta. I'm out of the regional office that's based in Atlanta. And yeah, I'm fairly new with the Centers for Medicare and Medicaid. My prior experience has been in social work, so I'm not completely foreign to what we do here. I love working in the community. I love working at the macro level and helping, people with health equity and healthcare. So I'm glad to be here tonight, and that's all I've got. Thank you again.
Thank you, Lisa. Nakia? You're on mute.
Of
Right.
course I'm on mute. Nobody did that but me, right? So I'm Nakia Jones. I am a health outreach specialist for regions 5 and 7. So that's about 10 states covered. I got Illinois, Indiana, Michigan, Minnesota, Ohio, Wisconsin, Iowa, Kansas, Missouri, and Nebraska currently. So primarily working with the Inflation Reduction Act, and currently I'm assisting with Medicare open enrollment and marketplace open enrollment. I'm really glad to be here. Thanks, Dr. Burnett, for having us, and Veronica for putting this together. I really look forward to the partnership and the information that will be shared today.
Thank you. Thank you so much. And then lastly, me and Dr. Burnett has introduced me, so I won't go into rehash all of that, but I just share that I also sit here in the Dallas Regional Office that covers a 5-state region, which is Texas, Louisiana, Oklahoma, Arkansas, and New Mexico, as well as I work with my peers, my colleagues, Christina and Dennis, in both Region 7, Region 8, and Region 9. So thank you for the opportunity to be here with you this evening. So what I'm going to do is I'm going to prepare to share my screen so that I can give you the latest updates on the Inflation Reduction Act. And let me, hold on a second. And as I'm preparing to do that, I just wanted to also let you know that in addition to the work on the IRA, I also serve as the lead in our office on on maternal health outreach. So I really enjoy who could share. Okay, there we go. All right. Enjoy having the opportunity to still work on other programs that are very, very near and dear to my heart. Can you guys see my screen?
Yes, we can.
Okay. All right, let me fix this at the bottom. And here we are. All right. All right. Good to go. All right. So this presentation that I'll do this afternoon is on the Inflation Reduction Act. And I want to just share kind of some of the presentation goals here so that everybody understands clearly what we're trying to convey, and hopefully everyone comes away with a clear understanding of what we're sharing. So here we want to talk about the Medicare drug price negotiation program. We're going to discuss the inflation rebate program, Part D improvements, vaccine cost sharing, expansion of extra help, and then the insulin caps for Part D and Part B. And it is our hope that you'll leave helping IRA, understanding how the IRA affects Medicare beneficiaries, know where to locate and how to utilize the CMS IRA resources that are available. A quick overview of the Inflation Reduction Act, just background on that. The Inflation Reduction Act was signed into law August of 2022. We just celebrated last month on August the 16th, the 1-year anniversary of the Inflation Reduction Act. The new law makes improvements to Medicare that will expand benefits, lower drug costs, and improve the sustainability of the program, of the Medicare program for generations to come. The law provides meaningful financial relief for millions of people with Medicare by improving access to affordable treatments and strengthening Medicare both now and in the long run. So those are things that we really are excited about, and there are a lot of great benefits that are already in place, effective right now. The Inflation Reduction Act, there are several provisions, CMS provisions that are in place because of the Inflation Reduction Act, and those provisions include a $35 monthly out-of-pocket cap on Medicare-covered insulins. It also makes ACIP, recommended vaccines, free under Medicare Part D prescription drug coverage. It temporarily increases Medicare payment for qualifying biosimilars to encourage use. Dr. Burnett, you know what that is. Requires manufacturers to pay rebates to Medicare if their price increases for certain drugs if they exceed the cost of inflation. And then it also makes Medicare Part D prescription drug coverage more affordable. So those, in addition to those provisions, I also want to share with you that beginning in 2024, people with very high prescription drug costs will no longer pay once they reach the catastrophic phase. Which that's really, really going to be helpful for a lot of folks, because we know that it's very expensive once they reach the catastrophic phase. And then also beginning in 2024, also full low income subsidy will be expanded for people with low incomes, lowering premiums and out-of-pocket cost for their prescription drug coverage. So the low income subsidies that we refer to sometimes as the extra help programs and such. So beginning in 2024, those folks will see lower cost, and in some cases no cost, for their out-of-pocket prescription drug coverage. Beginning in 2025, all people with Medicare Part D will have a $2,000 annual out-of-pocket cap on their drug cost. That's very significant. I'm going to say it again. All Medicare Part D folks that receive Medicare Part D will have a $2,000 annual out-of-pocket cap on their drug cost. And then additionally, this allows Medicare to negotiate the price of certain high-cost brand name prescription drugs. The next piece that I want to talk to you about is the Medicare Drug Price Negotiation Program. For the company, so what is going to happen is Medicare will now be able to negotiate and renegotiate drug prices of certain Medicare drugs with drug manufacturers. For the drug companies of selected drugs that elect to participate in the negotiation program, the maximum fair prices that are negotiated will apply beginning in 2026. And we do have additional resources that we'll share at the end, where you can get more information on what the Medicare Drug Price Negotiation Program, what it looks like, and what will happen over the course of the next few years. The Medicare Drug Price Negotiation Program, what will happen is for the first year of the negotiation program, CMS selected 10 high expenditure single source drugs for negotiation on August 29th of 2023. CMS will select up to an additional 15 drugs for negotiation for 2027, and up to an additional 15 drugs, including drugs covered under Part B, for 2028 and up to an additional 20 drugs for 2029 and subsequent years. And I know that sometimes we say, wow, a couple of years down the line, but as we all know, time waits for no one. So we are excited about these upcoming, the new opportunities to have these drugs and the drug prices negotiated. Secondly, the Medicare drug negotiation program also has several phases. CMS will continue to issue guidance as the phases progress. The first round of negotiations will occur during 2023 and 2024 and result in prices effective in 2026. 2023 milestones include on July 3rd of 2023, the deadline for drug companies to submit a request for a drug to qualify for the small biotech drug exception. Also, in the summer of 2023, the revised data collection ICR was issued this summer, and a separate ICR on the negotiation process is being issued also for public comment. On September 1st of 2023, the deadline for CMS to publish the list of the 10 drugs selected for negotiation for 2026. So that actually went out on August the 29th. So that's happened already. And then October the 1st of 2023 is the deadline for participating drug companies that manufactured the drugs selected for the negotiation program for 2026 to sign agreements to participate in the negotiation program. So October 1st will be the deadline for participating drug companies that manufacture these drugs for them to sign agreements to participate in the negotiation program. October 2nd is the deadline for drug companies that manufacture the drugs selected for the negotiation program for 2026 and that have signed an agreement to participate in the negotiation program to submit manufacturer-specific data to CMS for consideration in the negotiation of a maximum fair price. In addition, this is the deadline for the public to submit data on therapeutic alternatives to the selected drugs, data related to the unmet medical need, and data about the effects on specific populations. In the fall of 2023, CMS will provide additional engagement opportunities through patient-focused listening sessions. These listening sessions will be open to the public, including patients, beneficiaries, caregivers, patient consumer advocacy organizations, and other interested parties to participate. So additional information about these public listening sessions will be shared in the late summer. Also, in the fall of 2023, CMS will provide additional engagement opportunities for participating drug companies that manufacture selected drugs to meet with CMS to discuss their October 2nd data submission. And then beginning in 2024, right now, the milestones include a deadline for CMS to send an initial offer of a maximum fair price for a selected drug with a concise justification to each company participating in the negotiation program. March 2nd of 2024 will be the deadline for participating companies that manufacture selected drugs to accept the initial offer of a maximum fair price or propose a counter offer. If desired, companies have 30 days from receiving CMS's initial offer to respond. And then in the spring and summer of 2024, CMS will provide up to 3 meetings during the negotiation period with companies
Go ahead. Veronica, your slides have not moved.
They haven't.
We're still at October 2nd.
I'm sorry. I think I'm going over, these are the timelines here. There are a lot of them. My apologies. Can you see this slide now?
Yes, ma'am.
Okay, so this is basically going over the timeline of the drug negotiation program. So I'll just move on from this, and we can make this available to you, but this is basically what I'm sharing now are some of the points that are going to happen at each of these negotiation timeline deadlines, if you will. So that is the piece that I want to share as it relates to the Medicare drug price negotiation program. So drug inflation rebates. what that means is that it requires drug companies that raise the prices for certain products faster than the rate of inflation to pay Medicare Part B or Part D a rebate. So this is really helpful because what it also will do is ultimately it could also assist beneficiaries with will pay reduced inflation adjusted co-insurance rates for 43 Part B rebatable drugs. So this is an effort to also assist with some Part B beneficiaries to see lower cost on their co-insurance rates. So we are excited about that as well. Additionally, the drug price inflation rebates in Medicare, you see here where we're sharing that CMS will require to monitor drug prices during the applicable period, compare them to the benchmark price, adjusted for inflation, make adjustments in certain cases, and then invoice manufacturers for the remaining difference. In each case, we're to identify and exclude 340B drugs, and then under the Medicare Part B drug inflation rebates, which started April 1st of 2023, if the Medicare payment amount for a calendar quarter exceeds the inflation adjusted payment amount, beneficiary co-insurance is equal to 20% of the inflation adjusted payment amount. So this is some very technical information. We can share some of the resources and information that provide additional information on this, but we wanted to highlight some of what the benefits are and how we're working to help assist Part B beneficiaries as it relates to how the drug inflation rebates work for Part B drugs. And then Part D improvements. So this redesigns the Part D benefit and it revises its parameters as follows. People with very high prescription drug costs will no longer pay once they reach the catastrophic phase, provides for the Part D premium stabilization beginning in 2024 by capping base beneficiary premium increases per year to no more than 6%. And then beginning in 2025, people with Medicare prescription drug coverage will benefit from a yearly cap, $2,000 in 2025, on what they pay out of pocket for prescription drugs. The cap on out-of-pocket cost will increase annually by the rate of inflation starting in 2026. Thus, in 2025 is the only year for which the cap will be precisely $2,000. They'll also have the option to pay their prescription drug costs in monthly amounts spread over the year rather than all at the beginning. So that is something that we also are looking forward to folks really having the opportunity to spread out the cost of their prescriptions over the course of the year. And that will be beginning in 2025. The new discount program will require drug manufacturers to pay discounts on certain brand name drugs and other types of drugs and biosimilars, both in the initial coverage phase and in the catastrophic phase of the Medicare prescription drug benefit. In general, manufacturers must provide a 10% discount in the initial phase and a 20% discount in the catastrophic phase. So that's all good news to help curb the cost, out-of-pocket cost for consumers, beneficiaries when they go to get their prescription drugs. Something else that is really exciting and new is the Part D coverage of adult vaccines, and those vaccines that are recommended by the Advisory Committee on Immunization Practices, which is ACIP. What that means is that it requires that Part D sponsors eliminate the deductible and co-insurance or other cost sharing with the respect of these recommended vaccines. The IRA requires a temporary subsidy payment to Medicare health and drug plans during 2023 for the reduction in cost sharing and deductible for ACIP recommended adult vaccines. In 2023, the cost sharing amounts, including deductibles paid by the Part D plans, count toward incurred cost for people with Medicare. So this was effective in January of 2023. So in short, what this means is that there is no longer any cost sharing for adult recommended vaccines. This also includes vaccines such as the shingles vaccine, which we know is very, very expensive, and the Tdap and others. So we are excited that these vaccines that are recommended will no longer have any cost sharing associated with them. And that actually went into effect in January of 2023. And then also, we're going to be improving access to adult vaccines for individuals under Medicaid and CHIP. And that will be effective in October 1st of 2023, which is technically the first day of the first fiscal quarter that begins on or after the date that is 1 year after enactment. So we are really excited that these vaccine coverages will extend to folks that are on Medicare, Medicaid, as well as CHIP, in addition to our Medicare beneficiaries on Part D plans. Also beginning in January of 2024 will be the folks that are receiving extra help, or what we also know as the low income subsidy programs. There will be no out-of-pocket cost for individuals that are on these programs. So people with limited incomes and resources up to 150% of the federal poverty level, people with Medicare who are currently enrolled in partial extra help will automatically be converted to full extra help, and they won't need to take any action. So this is also a benefit that will be effective January 1st of 2023. So Medicare people that are currently enrolled in the extra help program will newly be eligible for these expanded benefits, including no deductibles and no premiums, and fixed and lowered co-payments for certain medications. So that is another bit of good news. And then here's the benefit that you hear the most about, and that is on probably that you've heard the most about, but it's really particularly special for me, and I'm sure to many others. Just last summer, I lost an uncle who's only 58 years old to complications from diabetes, because he struggled with being able to get access to his medications when he needed them. So he succumbed to diabetes. But now, as of January 1st of this year, the cost of a month's supply of insulin is capped at $35. So we are really happy to share this good news and make sure that we get this information out to as many people as possible. And then for a 60 or 90-day supply of insulin, the cost can't be more than $35 for each month's supply of each covered insulin. So this is good news. Here you'll see kind of the IRA provision timeline. So this kind of gives you a snapshot of all of the things that have happened since the passage of the IRA and what we can look forward to in the years to come. So you'll see from August of 2022, here you'll see things all the way through on this timeline reflected through 2026. So that is just about all that I have here. We have several different resources that are available that really goes in depth about a lot of the things that I've shared and talked about already. And then we will make sure that we make these resources available to you, Dr. Burnett, so that they can be shared with everyone. And the key things that we want you to remember from this presentation is that there's a $35 on a month supply of insulin. Adult vaccines, adult recommended vaccines are now available without cost sharing, and there's no deductibles, and that's effective right now. People with original Medicare and Medicare Advantage may, depending on their coverage, pay a lower co-insurance for Part B drugs. And then also the new drug law expands eligibility for the full low-income subsidy benefit known as the Extra Help Program. So that here's some additional resources, and it kind of tells you what you can do. You can share your feedback with us. I mentioned listening sessions that will be available also on the new drug program. So we'll make sure that we get that information out so that you can share it widely, so people have an opportunity to put share their input. And then here's where we come to questions. But I don't know that anybody in this group has questions, but I just wanted to make sure that I gave you an opportunity to ask any if you had any, because I know we're running short on time.
I have been dropping things into the chat, and
Mhm.
Lisa has been answering them as we go.
Thank you.
So it's been very wonderful, and thank you very much. I have asked, the questions I have asked, and we now have answers to in the chat are how do we get access the listening sessions? She provided the link for that, as well as how do persons gain access and more information on the Extra Help Medicare program. So and that's both of those have been dropped into the chat. So in addition to the resources slides that you provided, we now have the direct links that are in the chat and will be available in the recording. Let me ask, we have 3 members, key members of our Alzheimer's and other dementias steering group committee on the line. We are led by Sister Rosalind Thibodeau Goodall. She is on the line, as well as Presiding Elder Raymond Bryant of the San Antonio District, and Brother Chris Likes, who leads our Legislative and Advocacy Committee of our Alzheimer's and other dementias group. Key people as it relates to this and getting the word out. I'll ask if any of you all have any questions at this point. If not, we can go on to the Medicaid. I see Rosalind has unmuted. Yes, ma'am.
I was just going to commend Ms. Moore on the excellent presentation. A lot of very valuable information shared, and I look forward to reading more about it with the slides and other information that's been dropped into the chat. Thank you very much, Dr. Burnett, for this opportunity and for bringing this to us this evening.
Thank you.
Thank you. Thank you so much for your comments. All right. Dr. Burnett, did you want to introduce Angela? Angela, you want to go ahead and get started?
Sure.
Okay.
Let me introduce her. I almost said Sister Angela Kane. Angela Kane is been with the Centers for Medicare and Medicaid Services out of the Baltimore office since 1988, where she served as Medicare beneficiary in the Medicare Beneficiary Services offices. She is now in the Office of Program Operation and Local Engagement in the Dallas office as an outreach specialist. She she helps with sharing information and resources about the Medicare, Medicaid, and CHIP program, as well as the health insurance marketplace program, and stays engaged with local partners and community stakeholders. Let me also add that while we were going, while everyone was introducing themselves, both Veronica and I decided that we would also have additional sessions, could even be in podcast format, on the No Surprises Act as well as the marketplace. So look for those to be coming shortly. Angela?
Thank you. Thank you, Doctor. I appreciate it. Hello, everyone. I am here. I work at the Dallas office, and we oversee the states of Texas, Louisiana, New Mexico, Oklahoma, and Arkansas. And I'm very happy to be here to share with you a little bit about the Medicaid continuous enrollment condition and what it means for people enrolled in Medicaid and the Children's Health Insurance Program as we return to normal operations after the COVID-19 pandemic. So each year Medicaid, and I'd like to share my screen. I pulled up a website that is.
You have permissions to do that.
Thank you. Thank you. So this is the Medicaid.gov/unwinding website, and you can read through it as I go through the high-level talking points. So each year, Medicaid coverage must be renewed. However, during COVID, people with Medicaid and the Children's Health Insurance Program didn't have to worry about renewing their coverage because the public health emergency paused renewals to ensure as many people as possible stayed covered during the pandemic. This was because of the continuous enrollment condition. As a condition, which was a condition where states received increased federal funding, but were required to maintain enrollment for almost all of the Medicaid enrollees. The continuous enrollment condition ended on March 31st, as Dennis pointed out earlier. So as of April 1st, states started terminating Medicaid enrollment for individuals no longer eligible. You may have heard this process referred to as unwinding. Now that the continuous enrollment condition has expired, states have started eligibility renewals for the state's entire Medicaid and CHIP population, the Children's Health Insurance Program. States will be distributing or have been distributing renewals over a 12-month period and will complete renewals within 14 months. Some states, such as Arkansas, are doing it in a shorter period. They're doing it in 6 months. Everyone with Medicaid or CHIP health insurance will need to renew their coverage before May 2024. And many have already been through this process. The Biden-Harris administration is committed to maximizing the number of people with affordable, high-quality coverage. We want to make sure people stay covered, whether that's through the Medicaid, Medicare, the health insurance marketplace, or employer-sponsored coverage. Since many people enrolled in Medicaid have not had to complete a full renewal process in nearly 3 years, if ever, we want to make sure that people enrolled in Medicaid and CHIP are aware that this is coming and know what steps they need to take to keep health coverage, whether that is through the Medicaid or CHIP or another health coverage option like the health insurance marketplace, which can be, a person can go to healthcare.gov to apply. According to the Assistant Secretary for Planning and Evaluation, unwinding is projected to cause approximately 15 million individuals to lose Medicaid and CHIP coverage, with approximately 6.8 million losing Medicaid coverage and still being eligible. Children and young adults are likely to be impacted disproportionately, with 5.3 million children and 4.7 million adults ages 18 to 34 are predicted to lose Medicaid or CHIP coverage. Nearly 1/3 of those predicted to lose coverage are Latino and 15% are Black. These are populations that, as you know, were highly affected by the COVID-19 pandemic, but experienced health disparities long before. Knowing these predictions ahead of time, we hope that with your help, we can do everything possible to mitigate further disparities in coverage and access to care. So we have 4 main messages. They are: update your contact information with your state Medicaid or CHIP agency, respond to the Medicaid or CHIP renewal form when it arrives to keep your coverage. Parents should respond even if you don't think you're eligible. Your kids could still be eligible. And consider other coverage options. If you're no longer eligible for Medicaid or CHIP, check to see if you can get coverage through your employer, through the Affordable Care Act marketplace at healthcare.gov, or through Medicare. And these messages are, we want our partners to focus on these messages and help us get the word out to people who are enrolled in Medicaid and CHIP. So we have unwinding resources and toolkits, and I'd like to show that. Some of the resources on this page, and quickly go through this. So on the unwinding homepage of Medicaid.gov, which I just showed, it has a centralized location where states and stakeholders can learn more about the unwinding and returning to regular operations. It has an all hands on deck fact sheet, partner call to action, monitoring. It has tools and templates to help states prepare and plan for unwinding. Medicaid and CHIP beneficiary resource page, which is at medicaid.gov/renewals. And this is where consumers or people who may be eligible for Medicaid can go to, and they can look up their state and prepare their renewal or apply for coverage. And then we have the Unwinding Communications Toolkit. And we have it in several different languages, English, Spanish, and other languages here, Korean, Hindi, Chinese. These toolkits provide key messages and materials for states and stakeholders such as you all to use when communicating with your networks or through your networks about Medicaid and CHIP continuous enrollment unwinding. And we have an outreach and educational resource page on medicaid.gov/unwinding. And I will share this resource and toolkits spreadsheet with you all. And we also have monthly Medicaid and CHIP renewals webinars, what to know and how to prepare a partner educational monthly series, and the link to register for that. We have a link to request speaking engagements. We are here as an outreach specialist, and on behalf of all of the outreach specialists at all of the regional offices, we are here for you. And so you can go to this link and request us to speak on any of the programs that CMS administers, Medicare, Medicaid, or the health insurance marketplace. We also have a back to school campaign toolkit. And okay, that is that. And I will stop sharing, but we have a call to action. The call to action for our partners, since day one, we have worked to do everything in our power to keep people covered, including working with the states to make Medicaid renewal simpler for consumers and auto renewing coverage for eligible people, and to make it easier to get low or no cost coverage in the marketplace. Families of 4 can get health insurance, a quality health insurance, for as low as $10 or less per month. This work is an all hands on deck effort and will continue to be. We urge all states to take up all of the strategies we have put on the table to make renewing coverage easier. We also urge our partners, such as you all, in the public and private sectors, faith-based sectors, to directly reach Medicaid enrollees and help them complete their renewals and help connect them to other coverage as appropriate. And I think I will end it at that. And just remind you of our monthly Medicaid and CHIP renewals webinars, and I will share the toolkit resource with you. Thank you.
Thank you very much. We definitely would like the toolkit as well as all of those resources, even before we get permission to release the video. We can distribute this information and get our local regional, using words you would know, local regional offices to be able to invite you in to do these very necessary trainings. And I intentionally referred to them as trainings so that we can use what we like is a train the trainer model, where we train our leadership then goes back to local congregations, and we move forward from that. I'll have you know, during the initial releases, and I think many congregations are still doing this, I trained our young people's division to assist our elders, our seniors, with completing the online applications. And that happened a little bit everywhere. And so we will, whenever we need to use online information and our seniors they're not tech savvy, we engage that kind of a process. So we will have to do that again. This time it looks like. Sister Rosalind, I see you.
Yeah, great presentation again, Ms. Kane. I used to be on the board of the North Texas Food Bank, and I know we hired a social worker over there, to try to help individuals apply, because at the time, and this was some 10, 15 years ago, if you made one wrong entry on your application, they just threw it out. So I'm assuming they still have those social workers there. So my question is this: Dr. Burnett shared with me a very comprehensive flyer, and I wonder if you all are planning to put those flyers at such places, at food banks, at agencies that are served by the food banks, at clinics, minority clinics, especially, at the MLK Center and those kinds of places there in Dallas. The other thing I wanted to, there was something else I wanted to ask, and I just lost my thought. But if you can answer that, I'll probably remember it.
Yes, thank you for that question. That's a great idea. We would love to do that. We need to reach out to those partners and get the material printed and take them by there once we get permission to do so. So thank
I
you.
think it would be a great idea. And the other
Yes.
thing I was going to mention, I'm sitting in Shreveport, Louisiana now, and
Mhm.
every day on a certain television station, they talk about Medicaid enrollment and re-enrolling. But I don't think people really understand this. And I was mentioning that to Dr. Burnett. I said, do you mean that Medicaid recipients have to re-enroll? I don't think that comes across clear. It's an advertisement, but I don't think the message is, they don't say you need to, you must re-enroll. So there's some, I would suggest that you might think of some other verbiage that would be a little easier for people who receive Medicaid benefits to understand that it's critically important that they do so. Just a thought.
Thank you. I appreciate that. We do have the tested marketing material. We have cards, and we have tarot pads, and it just says, look out for renewals. It's time to renew your Medicaid, and you need to take action. And so the links I send you, you'll be able to see those. It's supposed to be like easy wording and quick catching wording, and I will share that the links with you, and the material can be ordered free of charge. And yeah, but thank you for that suggestion.
Have you been able to test? I know, oftentimes marketing people are not the people in the community. So have you been able to test how that works? Have you been able to test those marketing, that marketing collateral?
Yes, well, our Office of Communications said that the marketing, the messaging was tested, and
I mean, in the community, you say that in the community, you have all these things going on in the community. What percent of the people in the community are responding to that?
I apologize. I don't have the answer for that, but I will send that message on, that question on, to see how they respond to it, and I can get back to you.
And I'm not asking for a response. I just think it's good for you to have that information to see how effective your messaging is.
Oh yes, absolutely. Yes.
Okay. Thank you so much.
I wanted to comment on that. Thank you, Ms. Goodall. I think that's really important, and just like Angela said, she will share that information up. But what we know, especially, when you've worked in the community for so long, just some things just don't resonate. And I think that it is important for people like yourself and all on this call to give us that feedback so that we can make sure that the messaging that we're using is resonating, and yes, we can, say, we do know that our Office of Communications does, works really hard to try to make sure that the information that's shared is, in a way that's going to really resonate with our communities, but sometimes, still miss the mark. So I appreciate you sharing that feedback. And, I think one of the things that's really important for us, which is why we are coming to you, is, you just have to sometimes talk to people, and, word of mouth, and really just having a conversation with folks. So being at the food banks and being in the community at events, or just, sharing in the most unexpected places, sometimes, it really helps us get the word out. So we appreciate your feedback, and I really,
Yeah.
really do want to assure you
Absolutely.
that we really want to be able to do that, because I really like hearing Dr. Burnett talk about, having the young people assist the elders, because, I know that my mother calls me all the time. How do you do this? Ma'am, listen, I don't know. I have to call my kids to help me, but thank you for that
Thank
feedback.
you. Thanks so much.
You should see Rosalind and I trying to do things on these Zoom calls, and both of us say, I don't know. It's kind of funny.
And she's younger than I am. And she's younger than I am.
Oh, but
It's kind of funny. I think one of the other things that we need to make sure we have access to is, how do we get the print material so that we can put it in strategic locations to include, now that our churches are reopening. We don't know where that's going, though, with these COVID numbers going back up. But as they go back in, folks like things in their hand, to be able, and that also allows the outreach to. I found this. I can't tell you the number of times I've heard this. I picked this up at my church. Here, you need this. And they don't know that I'm the one that picked it, that put it there.
Right.
But it's real helpful when we can have that. So we need to be able to have access to those materials at a variety of levels, at our Episcopal district levels. I told you before, this is our annual conference series. If time period, we had materials that we could distribute at those conferences. That's our leadership. Every church has to send a delegate. They walk back with key information. And so it's important, especially as we reach the October 15th, as well as all of the deadlines around Medicaid. Now, let me say this again at the end here. The Medicare open enrollment is October 15th through December 7th. Are those correct dates?
Yes.
Marketplace dates are what? It's different dates.
November 1st through December 15th, in order for the insurance to be effective on January 1st. And then, but it goes through January 15th. But if they enroll after December 15th, it'll be effective February 1st.
Okay. And then the other piece becomes the Medicaid renewal process is happening now. And folks need to be proactive, and don't wait for the letter to come in the mail, and don't throw away the piece of paper that looks like it's an advertisement.
Thank you. Please make sure their contact information is up to date so the state can reach them. Thank you.
Angela, I have a question. I know this used to work. We did this a lot with the Affordable Care Act, but are there pulpit announcements available? And is that something, Dr. Burnett, that you think would be helpful? I know that, you have pulpit announcements, and then we have various digital pieces that could go on, on the screens for those churches that have those capabilities. So I'm sure that we have some of those resources are available, and some of the toolkits that we have. I know that there's a toolkit very specifically for the faith community. So I think Angela may have shared it there already, but I just wanted to highlight that and make sure that that's something that still you think would be helpful.
I think it would be very helpful. Even those churches that are in person, and we do still have churches that are Zoom only. The ability to do that is very impactful. And one of the things that the Health Commission has always said is you don't have to be a healthcare professional to make these announcements, especially if we give you something to read. Just read it out loud.
Mm-hmm.
Yes, absolutely. And that the toolkits will have the link to all of that, the information for different faith-based and different ethnic groups. And also the CMS product ordering website information is on there too, where you can order material for free.
Okay, so you're going to email that to me?
Yes.
All right, thank
Absolutely.
you.
Thank you.
Sister Rosalind?
Ms. Moore, we're in annual conference in Dallas, and so we'll have a lot of churches from the surrounding areas there next week. So if you had a supply of those flyers, you could take by St. Paul AME Church, 2400 Metropolitan in sunny South Dallas.
Been there before.
And,
I will.
Yeah, and people would be Reverend Kevin Hodges, a pastor, Miss Patricia Hall is a secretary, and just tell them that I asked you to drop them by, because you'll have people from surrounding, Texas churches there during the week who can pick it up and help share it. So just a suggestion.
Absolutely. What day does the conference start?
Tuesday. I'm not sure what the date.
Okay.
Date is.
Okay. But it starts on Tuesday, so I will.
Through Saturday. So.
Okay. Well, I'll plan to try to get it over there on Monday.
Okay. All righty. That'll be good. Thank you.
Kentucky, Tennessee is meeting this week. No, next week. They start on Wednesday in Nashville. No, they're in Kentucky now. The following week they go to Nashville, and then they go to Memphis. So Alabama is in session as well.
And Louisiana is going to start in North Louisiana the 1st of October. So, Ms. Moore, I can send you my home address, and you can send it to me, and I can get it to the appropriate people.
Why don't I send you the annual conference series list?
That would be good.
That'd
And
be
we can make sure that we basically put everything together on the IRA, the marketplace, all of the resources, and have them all in one place and send them.
Yeah, Chris is in South Carolina in session now as well, different places.
Not yet. I think October, first week in October.
That's your conference, but all the other ones, they are ongoing.
Oh yes, they started. Yeah.
It really is that. It really is.
Okay.
Do each of
All
the
right.
leaders, or are they chosen against?
All right.
Those are the.
Thank you very much. All right. We will follow up with all of our deliverables we just talked about. We will get them distributed and let the word go forth that this information is available. We'll make sure the toolkit is out there, as well as we will do a follow-up on the marketplace and what was that other one?
Marketplace, IRA, and Marketplace and No Surprises Act.
No Surprises Act. We'll do another one of these on those two so that we'll be able to send them out. Lisa, I saw you unmute. I'm sorry, were you trying to help me with my memory?
Yep, that's all I was just gonna,
Okay.
I was gonna fill in.
Thank you. All right. I really appreciate your time, your effort. I will, it takes about an hour for the video to download, and I'll send it to you so that you can get the approval so we can mass distribute.
Thank you.
Thank you all. Have a
you
wonderful
all.
evening. Thank you.
All right, you do the same.
Thank
Be blessed.
you.
Thank you.
Bye. Thanks for having
Bye-bye.
us.
Bye-bye.
Thank you.